Imagine this, you have seen the same doctor for 12 years. You trust them completely, they know your entire medical history. Then one morning in January 2026, you call to book an appointment. And the receptionist says, "Sorry, your doctor is no longer covered under your Medicare plan. This is not a story." In January 2026, over 1.2 million seniors across America opened their mail to find their Medicare Advantage plans were exiting their local markets entirely, and their trusted doctors of years were gone overnight. And here is what makes this a scandal. The insurance company knew this was coming. For MONTHS, they sent a notice, buried in 40 pages of fine print, that most seniors never read. My name is Alex. Stay with me, because in the next 12 minutes I am going to show you exactly what happened, which major hospitals left, your legal rights, and the 5 steps you must take today. So how exactly do insurance companies get away with this? Let me explain how this system works, because once you understand it, you will be furious. Every year, insurance companies are required by law to send you something called an annual notice of change. It arrives in September or October. It is a thick envelope. Most seniors put it on the table and never open it. Inside that envelope, buried on page 34, might be a single line that says, "Provider network changes may occur effective January 1st, that one quiet line. That is how they told you your doctor of 12 years was leaving. Insurance companies have shrunk provider networks to save money, and these narrow networks are designed to save the insurer money, but they often leave you stranded without your preferred medical team. And now, experts are calling what happened in January 2026 something even more alarming. They are calling it the 2026 network purge. Faced with rising healthcare costs and tighter federal reimbursement rules, Medicare Advantage plans aggressively slimmed down their networks. And if your doctor was quietly dropped on January 1st, every visit you make now could be billed at out-of-network rates, costing thousands of dollars. Now let me show you exactly how big this problem is. 14 major hospital systems have dropped Medicare Advantage plans heading into 2026, citing persistent frustrations with prior authorization denials and slow reimbursement from insurers. I want you to hear these names, because these are some of the most respected hospitals in America. Number 1, Mayo Clinic. Rochester-based Mayo Clinic will be out of network with most Medicare Advantage plans from United Healthcare and Humana in 2026. Number 2, Mount Sinai. New York City-based Mount Sinai will be out of network with Anthem Medicare Advantage in 2026. Number 3, Mass General Brigham. Most primary care providers at Mass General Brigham will no longer be in network with Medicare Advantage plans from United Healthcare or BCBS Massachusetts. Number 4, UNC Health in North Carolina. Number 5, Lehigh Valley Health Network in Pennsylvania. And the list goes on. -14 hospital systems total. These are not small clinics. These are world-class hospitals, dropping Medicare Advantage because of how poorly the insurance companies treat both patients and doctors. As one expert told Newsweek, when 14 health systems drop Medicare Advantage contracts in 1 year, and half of seniors are in these plans, we have built a healthcare financing model that only works if hospitals accept below-cost reimbursement forever. Now, I need to tell you about something called a ghost network, because this might be the most dishonest thing happening in Medicare right now. A ghost network is when an insurance company lists a doctor in their provider directory as if they are in network and accepting patients, but when you actually call that doctor, they are not accepting new patients, or they left the network months ago, or they never agreed to be listed in the first place. A 2025 audit showed that up to 35% of doctors listed in Medicare Advantage plan directories were either not accepting new patients or had left the network entirely. 35%, 1 in 3 doctors listed in your plan directory, may not actually be available to you. Doctors are leaving Medicare Advantage networks because they are overwhelmed by increasing prior authorization requirements, denied claims, and administrative workload. Some practices must hire dedicated staff just to manage insurance hurdles alone. So doctors leave, but your insurance company keeps their name in the directory anyway. And you get the bill when you find out too late. Now here is where I give you power, because you have legal rights, and most seniors do not know they exist. Right number 1, transition of care. Your Medicare Advantage plan must protect you from interruptions in your medical care and ensure you have access to medically necessary covered benefits, even when your provider leaves the network. This is called transition of care, and it means if your doctor leaves the network while you are in the middle of treatment, Your plan must allow you to continue seeing that doctor at in-network rates for a period of time. How long? Typically 90 days, and longer if you are pregnant or receiving active cancer treatment. You must request this in writing, call your plan and say these exact words: I am requesting transition of care coverage for my current treatment with doctor name under federal Medicare regulations. Write that down, write number to special enrollment period. If Medicare Advantage enrollees discover that plan directory information was wrong and their doctors are not in-network, they are eligible to switch to a new plan that includes their providers, or go to original Medicare during a special enrollment period for 2026. This means if your plan gave you wrong information about your doctor being in-network, you have the right to switch plans outside of normal enrollment periods. Call 1-800-MEDICARE and say, I want to report a significant network change and request a special enrollment period. Okay, here are your 5 action steps. Do these today, not tomorrow. Step 1. Check your doctor right now. Log into your insurer's website today and use their Find a Provider tool. Do not rely on old directories. Search for every single doctor you see. Go to your plan's website, search your doctor's name. If they do not appear as in-network, call your plan immediately. Step 2. Check the new Medicare Plan Finder. The 2026 Medicare Plan Finder now includes, for the first time, information about which doctors and providers are in a Medicare Advantage plan as network, so you no longer have to leave the site to check. Go to Medicare.gov, click Plan Finder, search your doctors. Step 3. Request transition of care if needed. Use the exact words I gave you a moment ago. Call your plan, request it in writing, keep a record. Step 4. Consider switching to original Medicare with Medigap. Seniors who want to keep all their doctors often find that only Medigap plans offer the stability they need, because Medigap allows you to see any doctor who accepts Medicare, eliminating the fear of losing providers when insurers exit markets. Yes, Medigap premiums are higher, but peace of mind has a value. STEPFIVE. Call your free SHIP counselor. Every single state in America has a free Medicare counseling service called SHIP, State Health Insurance Assistance Program. These are unbiased counselors, not brokers. They do not earn commissions. Call 1-800-MEDICARE and ask for your local SHIP office. They will review your plan, check your doctors, and help you find the best option, completely free. Let me give you the summary before you go. In January 2026, the 1.2 million seniors lost access to their trusted Medicare Advantage doctors overnight. 14 major hospital systems, including Mayo Clinic and Mount Sinai, dropped Medicare Advantage plans. Over half of all Medicare beneficiaries, 34.1 million seniors, are enrolled in Medicare Advantage plans, making these contract terminations increasingly serious for patient access across America. But you now know your rights: transition of care, special enrollment period. The 5 steps to protect yourself. If this video helped you, please hit like right now. Every like helps this information reach another senior who needs it. Drop your state in the comments below. Tell me, did your doctor disappear from your Medicare plan this year? I read every single comment. Subscribe and hit the bell, because every week I bring you Medicare news that the mainstream media is not covering. Stay protected. See you in the next video.